Okay, good morning, everybody. This is a recording lecture for calcium regulating hormones and the other agents which is affecting the formation of bones and the stuff. So we will discuss about what is calcium and how it is, what are the things is important over calcium whenever we use calcium in the deficiency or in excess of calcium. What are the things that might leads to occur in the body? So we'll have a class today online because okay, so as we know, calcium regulating hormones. What is basically a calcium? So calcium is an ion which is like present in the body. Okay, there are so many different types of ions which are present, like sodium, potassium, calcium, chloride, etc., etc. So based upon that, like one of the most important ion which is present in the body is calcium. And the body, the major functions will also carried out by the calcium, and it is having different excitation, contraction, and formation of bones, and etc. etc. So basically, a calcium plays a very important role, and it is like the tooth and the bones. These are the things are made up of calcium. So we'll discuss what is calcium and how this calcium is getting regulated in the body and how it is affecting the different stuff. So before so the major drug classes where the agent that promotes the calcium, like especially the vitamin D metabolites and analogous and parathyroid hormones. Okay, so these are the places where the calcium plays a major promote calcium. And the agent that inhibits the calcium, like it is biphosphate. Inhibiting means stopping the calcium. Okay, inhibition of the calcium and calcitonin and estrogen hormone. This calcium is basically plasma calcium. The plasma calcium concentration is normally maintained with a narrow limit of 8.5 to 10.4 milligram per deciliter. So this is a basic thing, that the calcium which is maintained in the body, which is around 8.5 and 10.4 milligram per deciliter. And here, whenever then if there is a calcium, excess of calcium which is there, which is produced, which is more than 8.5, or first we'll see what is like less calcium. The calcium level, if suppose it is less than 8.5 milligram per deciliter, and then that is something called as hypocalcemia, an increased neuromuscular excitability and tendency to impairment of mineralization of the skeleton. But whereas when the calcium will become in excess, like more than 10.5, it is called hyper. So here we know that, like if there is a deficiency of calcium, then it is hypocalcemia. And when there is an excessive calcium, means like more than the required calcium, then it is called hypercalcemia. And hypercalcemia, it is like more life-threatening condition, like it can lead to cardiac dysarrhythmia and soft tissues calcifications, like it can cause like excess what is dysarrhythmia means irregular heart rate, and it can form stone formation in the body. It can be a kidney stones, or it can be neither, and that maybe lead to some abnormality as well. And the physiological role of this calcium is, what does this calcium do in the body? Calcium plays and control excitability of the nerves and the muscle, regulates the permeability and integrate the cell membrane, regulates the cell adhesions. Calcium ion is basically responsible for essential excitability. Okay, means it will activate excitation of the neuron or of the muscle and release reaction of exocrine and endocrine glands release to the transmit of nerve ending, and that leads to the amount of calcium and release to that nerve ending that will help in the release of some neurotransmitters. Intracellular messenger for hormones and the autocoids. Impulse generation in the heart. Impulse means when we talk about like heart, it is like four chamber, isn't it? And in the SA node and AV node, what we discuss. In the SA node, whenever the impulse is generated, the electrical discharge, the conduction, which is generated by the calcium from the SA node. Coagulation of the blood, blood clotting factors, and structural functions in the bone, teeth, and abnormalities of this calcium balance affect teeth indirectly. So it is not a direct process, it can be an indirect process. The primary site of regulation of calcium level by the kidneys and gastrointestinal tract and bones. The GI tract can normally absorb almost 10% of the calcium to the 20% from the dietary means, from the food what it takes. And effectiveness is directly dependent upon the level of vitamin D. So what is the vitamin D? Vitamin D is the uh, from where we get vitamin D. We get vitamin D from the sunlight, from the sunlight, and an artificial source of vitamin D could be can be because like we can take some vitamin D supplement medication, the tablets. And kidneys, renal tubular absorptions recover almost 10 to 20 grams of calcium per day. 10 to 20 grams of calcium per day will be restored by the kidney. And skeleton bone is the major site of calcium storage. So here the bones are the major site where the calcium is stored and containing approximately 1 kg to 70 kgs in humans. The loss of calcium will have a loss of normal bone structure, and the integrity can lead to and results in the some can be because of some drugs, it can be because of some disease, it can be because of some nutritional deprivation. But whereas the disease affecting bone integrity, that can be leads to the disorder of calcium metabolism. It can sometimes then lead to the because of calcium metabolism. And the bone diseases which are associated with increased morbidity and mortality associated with the calcium, that is something associated with some fractures. So suppose there is an imbalance of calcium which is there in the bones, then there is a possibility that the patient is more prone to get any fractures of the bone when compared to the normal the person who is having a sufficient or the equal amount of equilibrium maintained calcium levels. The pharmacological treatment of such diseases are dependent upon the cause of severity of a disease and the condition where the patient is suffering for. The next is hypercalcemia. What is hypercalcemia? Hypercalcemia, as we discussed previously, is a common result in onset where the hyperthyroidism, low level of parathyroid hormone, and pseudohypothyroidism, that is resistance to the parathyroid hormone. The next is the resulting the imbalance of the calcium may be due to the excess of calcium secretions from the kidneys, from the renal secretion, or the decreased formation of calcitonil. That is something which is an inactive form of vitamin D. And decreased bone reabsorption and the disease in intestinal, that can be something because of the absorption of the calcium which is decreased from the intestine. The next thing is hypocalcemia. As the name itself indicates, it is decrease or the less amount of calcium than the body required. So here, the therapeutic strategy for including whenever there is a deficiency of calcium, that hypocalcemia, a supplement of calcium salt will be given, like calcium tablet, or the calcium gluconate medication will be given, or the indirect method where it is given vitamin D in a combination of calcium gluconate. So vitamin D or plus combination of calcium supplement calcium salt will be given to the patient to overcome in the case of hypercalcemia. In the case of hypercalcemia, what is hypercalcemia? Hypercalcemia, as we know, it is increase. So it is because of because of hyperthyroidism, and hyperthyroidism can caused by chronic renal diseases or parathyroid hormone secreting parathyroid carcinoma. And in the case of parathyroid hormone related protein producing malignancy or the bone wasting or neoplasm. The adverse effects over here is abdominal pain, constipation, nausea, increased risk of kidney stones, and the soft tissue calcification. So what over here? In the case of hypercalcemia, the primary hyperthyroidism is one of the factor, and this is caused by chronic renal diseases also, and secretion of parathyroid carcinoma, where in the case like the patient is suffering with some cancerous tissues which have been developed, that can be the reason. And the adverse effects over here of hypercalcemia is abdominal pain, constipation, nausea, skin risk of kidney stones, and soft tissue calcification. Next thing is the management of hypercalcemia. How do we manage the excess of calcium secretions in the body? The mild hypercalcemia is something where the amount is which is more than 10.5 milligram per deciliter, or it can be ranged up to 11.4 milligram per deciliter. And here the dietary restriction of the calcium maintain hydratations. And whereas the moderate hypercalcemia, where it can be more than 11.5 to 14 milligram per deciliter. Here, basically, it's considered to be a mild form of, but requires more aggressive, timely management plan, and it is necessary for the rapid reduction of the calcium levels. Saline infusion of the diuretics and the dialysis of the renal. When does the patient will undergo dialysis? The dialysis whenever it takes place when the patient is having non-functioning kidneys. So the kidneys are not functioning properly. So in that case, the condition arises where the patient undergo dialysis. And in the case of loop diuretics, means the drugs like furosemide increases the calcium and calcium and sodium excretion would take place. The slide is like little bit blurry over here, so you can refer to the actual slides what is there in the content, so it will be easier, I hope. And the severity of hypercalcemia over here, which is more than 14 milligram per deciliter, is a life-threatening condition which involves serious bone and the renal pathological conditions that may arise and requires a immediate and intensive treatment which has to be taken. The patient has to undergo a proper treatment to overcome this type of condition. And the rapid reduction of calcium intravenous administration. How can we reduce the calcium level in the body? By intravenous administration of biphosphate drugs. The biphosphate will be given IV in the form of IV to overcome this calcium, or without calcitonin, safest open. And the sodium sulfate as a chelator, which is also used over here, and tetraacetic acid, that is EDTA, ethylene diamine tetraacetic acid, that is EDTA, for a complex of calcium to accelerate its elimination. And loop diuretics like furosemides and ethacramic acid, which increases the calcium secretion and with sodium excretion. Glucocorticoids decrease calcium absorption and increase the excretions of the calcium. The glucocorticoids. What is glucocorticoids? It is a steroidal drug. It is a steroidal form of a drug that is used. That's why, because of it is decreasing the calcium absorption and increase excretion of the calcium. That's why the glucocorticoids are the drugs which is not recommended to the patient who is suffering with osteosporosis. This is because of deficiency of calcium. And if the patient is given glucocorticoids in that case, rather than the other steroidal drugs like prednisolone or other things, then there is a possibility that excess calcium, first of all, the patient is having a decreased amount of calcium, and then if you're giving glucocorticoid, then again it will decreases and the patient bones will become much more problematic. The next is other disorders where this calcium can be given. Disorder of the bone turnover, which are not usually associated with abnormal serum calcium and phosphate concentration, are also amenable in the therapy. In the case of rickettsia, rickettsia is a condition. So this is rickettsia, where a condition where the inadequate bone mineralization of during development, and osteomalacia, that is inadequate bone mineralization in the adults, can result this type of formation. An inadequate dietary intake, and it suits the formation of vitamin D, or it can activate the metabolic calcitrol, or resistance of the action for the hormone. And the treatment over here in this other type of disorders, what is the treatment we can give? The treatment can be given like administration of vitamin D or calcium, or the both can be given in the form of tablet or the capsule for tablet form. And the formation of vitamin D will be dependent upon the ability of calcitrol. So in this case, like to overcome this type of condition, the other diseases like in the case of rickettsia. So sorry, we came to the next slide. So in the case of rickettsia, what we have to do, we have to give a vitamin D supplement, or it can be a vitamin D plus vitamin, a combination of vitamin D and calcium, or else, depending upon the patient condition, we will give a vitamin D dependent ability or the calcitrol to overcome this type of rickettsia condition. The next condition is Paget disease. Paget disease is a bone characterized an excessive bone reabsorption and the formation leading to the area of structurally abnormality in the bone normal microstructure. And in the case of this Paget or sclerotic bone, which appears more radioplaque than the normal bones. Milder form of this can be treated by asymptomatically, and severe form of this is characterized by skeletal muscle deformality that are painful, and it can lead to the defects such as spinal cord depression and thickness in the hearing and impairment. And for this type of condition, the treatment what can be given to the patient like who is suffering. So use an agent that cause decreased reabsorption and facilitate more normal bone formation, such as calcitonin and the biphosphate or estrogen type of drugs, which will be given to the patient. And in this, calcium and the vitamin D may be also included in this type of conditions. Next condition is osteopenia or osteosporosis. What is this osteopenia and osteosporosis? These is an um, skeletal disorder that is characterized by compressed bone strength and predisposing to the increased risk of fracture. Here, the patient generally this osteosporosis and osteopenia. This is like generally occur to the more elderly patients, like who will be somewhere around more than about means geriatric patients, like above 60 and 80 years, and it's all depends upon the age factor, and sometimes it's not related. And this type of condition is like more commonly seen in the women. The indicator, like what are the indicators here? It's a decrease in estrogen level in the women's and men's, and low initial skeletal bone thickness and small sutures, family or the personal history of osteopenia or osteosporosis can be a genetic issue, and chronic hyperthyroidism and sustained immunosuppressive adrenocorticoids or the period of immobility can be seen. So in the case of osteosporosis and osteopenia, the person cannot be mobile. So that's why it says it can cause immobility. Diagnosis of this type of condition measuring the bone mineral density by scans and multiple regions of the skeleton. And therapeutic intervention is that non-pharmacological, like weight bearing and the muscle strengthening exercise has to be given for tolerance and reduction of the situation of high risk of falling as recommended. And here, whereas not in coming to the pharmacological management, where calcium and vitamin D supplement will be given to the patient in the case of all anti restorative agent and the bone anabolic agents. Calcium salts like lactase, calcium gluconate, and the citrate that provides 1 to 1.5 grams of calcium per day are recommended because there is a deficiency of calcium in the case of osteosporosis and osteopenia. And other agents like calcitonin and biphosphate 1 anabolic agents like has been given to promoting a new bone growth. The anabolic agent that is basically that stimulates the bone formations in the body. Next, coming to the vitamin D3, that is the other name is calciflora, the another name of vitamin D, where it is a natural form of vitamin D in the human, which is synthesized by the cholesterol in the skin and responds to the solar ultraviolet lights. But whereas vitamin D2, that is Ergo calciflora, that is a plant derivatives derived from vitamin D. And both D2 or D3 vitamins are present in the diet equivalent effective for the adults. The activation of vitamin D requires enzymatic hydroxylation by the liver in the kidney, and the liver of vitamin D hydroxylates the 25 hydroxy vitamin D, which becomes primarily circulating the metabolites. Whereas the other vitamin D3 D metabolites are inhibit the parathyroid hormone synthesis and secretions and affect differentiation of the cell type, including the keratinocytes. And here there is a vitamin D rapidly absorbed, and the oral administration bile salts are required to be absorbed. Absorption is impaired in the patient with the biliary sclerosis and during the steatovania and the excess loss of feces. And the therapeutic uses over here, where of vitamin D3 is in the treatment of rickettsia, osteoclemia, and hypocalcemia. Excess form of vitamin D and its metabolites can lead to the hypercalcemia. So here we have to be careful, like there should be no excess form has to be provided. Excess can of vitamin D can lead to the hypercalcemia. Next is parathyroid hormone. This is act directly by the renal tubule and decrease the reabsorption of phosphate and increase the absorption of calcium, resulting in decreased serum phosphate concentration and increase the calcium concentration. And the mechanism how it is affecting that the parathyroid hormones is affecting in the kidneys, in the muscle, in the bones, and small intestine, where the calcium is getting absorbed in the body. So this is something where the kidneys are showing the reabsorption of calcium from the urine and the excretion of phosphate molecule and the activation of vitamin D would takes place, and parathyroid hormone where in the case of osteoclast activity where the bone is having a more reabsorption of calcium which releases in the bloodstream, and the vitamin D in the intestine that causes increased absorption of calcium as a dietary from the dietary stuff, from means like the food what we intake. Next thing is calcitonin. So what is calcitonin? Calcitonin is secreted by parafollicular cells of the thyroid, and it decreases the post-perinodal absorption of calcium and increases the excretion of calcium, sodium, magnesium, chloride, and phosphate molecules. All the at the cellular level, where it inhibits the activity of osteoclast and decreases the bone serum calcium and the phosphate concentration, this calcitonin. And the calcitonin is having the ability of to decrease the decrease hypercalcemia and diminish the continued use. And treatment can be given of this calcitonin in the case of Paget disease in the bone marrow of osteosporosis. So it is used in the case of osteosporosis and in the Paget disease. And the disadvantage of this calcium where is like it shows some adverse effects like local hypersensitivity reactions that includes rashes and allergic reaction, and the patient will have a feeling of nausea. A potential problem of calcitonin, it can cause a loss of effectiveness and prolonged use. So here, even though you prolong usage, it can cause loss of effectiveness. And in the case of GI problem, where in the heartburn, so what we have seen in the previous slides, here the absorption of calcium that takes place in the small intestine. So here in the case of GIT problem includes like heartburn, abdominal pain, gastroesophageal reflux like GERD, diarrhea, and esophageal irritation and ulceration. All these effects can be minimized by biphosphate approved and available in the parenteral administration, means like given in the case in this case IV. Next here, the estrogen, it is a hormone which is regulating some amount of calcium in the body. Estrogen inhibits the bone reabsorption and prevent fracture due to decreased production of interleukins. And these interleukins are activated by the prompt survival of osteoclast. Reduction of this inhibition where the estrogen production can produce osteopenia and eventually osteosporosis. This situational commonly occur as a result in ovarian failure and ovariectomy or natural menopause. So here in the case, generally we're talking about the ovarian failure in case where the females, and if the ovaries has been removed from the body, or in the case of menopause which is attained by the woman like after the age of like 45 40 or 45 to up to 50 55 age, like it varies from every individual. And these estrogen supplements or the replacement indicates the postmenopausal woman to delay the onset of osteopenia and osteoporosis. So that's why we say the osteoporosis is one of the most common cause in the women is because of this reason of estrogen. Women undergoing normal menopause have been considered as a candidate of estrogen supplement to be reduced symptoms to delay the osteopenia or osteoporosis. Next thing is biphosphate drug. What is this biphosphate drugs is doing? Biphosphate is strongly interact with hydroxyapatite crystals in the bone and are specially released at the site of bone reabsorption. The first generation of biphosphates that includes etidronate, which is a high dose of effectively inhibit the osteoclast activity and decreases the bone absorption and reduce incidence of fracture. And this biphosphate is there also no associated with new bone growth. And the biphosphates are the second generation of biphosphate. They act as like the first generation to inhibit the osteoclast, and but they do not antagonize the effect of osteoblast and non-bone rebuilding. And the therapeutic uses of this biphosphate, it is used in the case of hypercalcemia, in the case of osteoporosis and Paget disease of the bone. So this is all about the calcium and the calcium regulating hormones, which is used the different drug and the vitamin D3 where it increases the absorption of calcium. And the disorder that could be because of deficiency of calcium and the excess of calcium that is produced in the body. The deficiency of calcium, some symptoms like osteoporosis and some diseases, and where the treatment is based upon the use of calcium. So, based upon the availability or the amount of calcium which is there in the body and the body needs and the patient condition and the diagnosis has to be done properly based upon that of vitamin D3 or the biphosphate estrogen or pyrethroid. So we have to identify the actual cause and we have to give the proper treatment based upon the diagnosis. So to overcome this type of conditions. So this is about calcium and the calcium regulating hormone. Okay, thank you very much.